Well, happy Wednesday, everyone. Dr. Sefcik here with the Life Enhancement Clinic, and I just want to talk to you briefly for this Whiteboard Wednesday about the need to know your LDL particle size. So, in the last video, we talked about the endothelium, and that endothelium is that thin lining, that single cell lining that lines the inside of each artery. And this serves as a protective cell that produces not only nitric oxide for vasodilation, but it serves somewhat of a barrier function so that it prevents things from getting into the actual muscle of the artery. Now, if you look at this diagram here, that single cell endothelium, that's a single endothelial cell here, makes up kind of a barrier function. And if that barrier function is lost, inflammatory molecules, small molecules can get past the barrier, and then now they can begin to develop plaquing inside of the artery walls. And this is that atherosclerotic process where you're getting an inflammatory immune reaction due to some of the abnormal particles that are getting into the artery wall. It kind of looks like a tennis net. And if you look at the endothelium and you picture like a tennis net, there are two types of LDL particles. There can be an LDL type A and an LDL type B. Now, this is important to understand because not all LDL, which oftentimes is referred to as bad cholesterol, and let me just say this for a moment, there's no such thing as good cholesterol or bad cholesterol. Cholesterol is cholesterol. There are different types of LDL cholesterol. There's a type that is a large, buoyant molecule, a type A, which it looks like think of like a beach ball. That beach ball's not going to make it through. It's going to fall to the ground. It's not going to make it through the endothelial layer. It's not going to make it to the tennis net. However, the LDL small, dense, like a tennis ball, golf ball rather, those are going to go straight through that endothelial layer, and that's where they have the potential then to deposit right here into the artery wall. So you need to know when you're measuring your LDL, what is your true risk? Take, for example, this diagram from SpectraCell. If you come in and your LDL is at 125, chances are your doctor is going to recommend some kind of statin medication. But we understand that statin medications do not change particle size. Matter of fact, they actually can increase some of the small, dense LDL particles, even though the LDL total number is being decreased. We also know that 50% of those individuals who have a heart attack have an LDL less than 70 or even 100, and so that is not the primary driver of cardiovascular disease. In this diagram here, you look at someone, and all four of these individuals, Jerry, Susan, David, Maria, all have an LDL of 125. But what we don't know on a standard lipid panel is what is the particle size. In this diagram, we have the lowest risk individual, Jerry. His LDL is 125, but the majority of his LDL particles are the large, buoyant type A. They're the beach balls. We're not concerned with that. And so this would be a low risk individual, whereas Maria, exact same LDL on a standard lipid panel, but when we parse that out and look at the particle sizes, we see that she has a large number of small, dense. Those are the ones that are going to cause the potential to cause atherogenesis and heart disease. So today's takeaway, go ahead and check your cholesterol levels, but make sure if you're looking at cardiovascular prevention and you want to know what you need to do, where you're at in the risk stratification, then you need to know what your total particle sizes are, and you need to know your LDL particle number. These are very important. There's a lot of other markers that are important we'll talk more about in the future, but I hope this helps to serve some help for you to understand the necessity of looking at your LDL particle size. Have a great day. Look forward to seeing you next week.